Good morning and welcome to the show. It's Monday morning, so you know what that means. It's Medical Monday with Dr. Roman Nation. Dr. Nation, thanks so much for coming back on the show.
Good morning, sir.
I always look forward to your health tips and see what's going on. I know
there's always something going on.
There's always some sort of outbreak. We've got Ebola, and
Still.
I heard there's some new protocols that have come out.
The last I'd read about it, the CDC was working on it, and they were reevaluating because of the new Dallas, Texas workers that have been infected.
Yeah, apparently not enough. Now, you've got some good news happening too, right? I mean, you're opening up a new
we
location.
do, yes, yeah. Our practice is expanding. I've got some new staff coming on, and we have a new location opening up just on the other side of the beach. So we'll be in Panama City Beach as well as in Lynn Haven now.
Okay, so where on the beach will it be?
It's right off of Thomas Drive. It's a little side street called McKelvey. So it's bigger than our current facility, and it's getting renovated right now, so we can get everything up and running.
In your current location in Lynn Haven, it's a beautiful facility.
It is.
It's just that you're kind of getting maxed out there, huh?
Well, we have a number of other providers that wanted to come join our team. So I've got another nurse practitioner joining us. Her name is Kim Broon. She should be on the show here within the next week or two, I hope. And then I have another dietitian joining us in addition to JT for all the weight loss stuff that we do. So she'll be available to see patients on the beach and in Lynn Haven as well.
Well, JT was an interesting interview because we talked about nutrition ad nauseum and body chemistry and all that stuff, and he's a smart guy.
You can really get into it, and I learn a lot from him every time we talk. And that's really, my goal as the leader of this whole thing is to recognize the talent for people that are passionate about what they do. I mean, we get people that drive from the far west end of the beach to come see us all the way in Lynn Haven, and pass a couple dozen other doctors on the way. Yeah. And really, I think it's not. We're good at what we do, but the majority of what brings people to us is one is word of mouth, and two, because we listen. Patients feel like when they come to see our clinic that they're taken care of, and that people understand what they're going through, and you're not just a number on the wall to sit and wait for your 6.5 minutes with the doc, and here's your prescriptions and out the door you go. We take care of a lot of things with a lot of people.
Well, just anecdotally, my wife's friend said that she saw you on a friend. It was also a patient of yours and JT's. And she was singing your praises. She was just like, they really read my labs. I mean, they spent some time reading my labs. And she's thrilled with the attention she gets from JT. And it's actually working for her. He's got me drinking almond milk now, so and that was just after a 10-minute interview with him here.
Yeah, there's a lot of little things that each person kind of brings to the table. Stephanie's had some work in neurology and pain management. Kim,
and that's your other nurse practitioner.
Yes, and then Mr. Dees has done primary care for a couple decades
Jim
now.
Dees,
Yep. So he's still there with us, and because we have a fair number of patients that are already on the beach, we're going to take the providers that are in Lynn Haven and put them part-time at the beach in the expanded facility. So.
Well, good. So now you'll have 2 locations. We can get all this great healthcare service.
Right. Yep. That's the whole benefit of it. And then I've got some other staff members coming on to help with wellness exams and lots of stuff that Medicare and these other agencies want us to do, and actually do it with some accuracy and with some pointed data. We have lots of diabetics who don't know when their last eye exam was, or people testing their feet for a neuropathy, those kinds of things. There's lots of other little details that when you look at Medicare and the insurance companies, the data that they want for prevention, that a lot of that gets overlooked because patients many times don't either know what they're supposed to get for prevention, or they don't want to go because it's not treating a symptom. They only want to go see the doctor when they're sick.
I guess the importance of data collection when it comes to treating a patient just can't be overstated, and it's something that people like me really don't do a good job of doing. We got to run off to the local weather, but let's talk about your new location a little bit more on the other side of your local weather, brought to you by the West Pittman Law Firm. westpittmanlawfirm.com. Welcome back to the show. I'm here with Dr. Roman Nation from Nation's Best Family Healthcare in Lynn Haven, and now on Panama City Beach.
Correct.
New location.
Yes, sir.
One thing that I've heard about your practice, and I think that resonates with a lot of people, is the emphasis that you have on wellness there.
Yes.
Rather than going in when you're sick and saying, hey, doc, fix me, go in, people get a baseline, see a dietitian, get some advice.
Yeah.
I mean, that's
We have a lot. I mean, the taking care of you when you're sick part for the most part is pretty easy. It's when the horse has already left the barn that things get much harder. We have folks that come in that wait and wait and wait until they're really sick, or they've had a cold for several months,
Right.
or all of a sudden they've been super tired for 6-8 months in a row, and you come to find out that they've had a cancer or GI blood loss for
geez.
years. Lots of other things, and that's why we want folks to come in at least once a year. We usually do it every 6 months. Is kind of our baseline. If everything's perfectly fine, and then we see you twice a year. One's for your checkup, and the other one's for whatever other problem visits that we're taking care of. And run labs specifically for that. A lot of folks don't do the kind of extensive stuff that we do to really look at all those things. And the way I was trained initially was like you had said, you get this whole set of lab work, and it comes back with 50 data points, and there's nothing flags on the high left or the high right. Then your labs are normal, but that doesn't tell you what's going on with the patient. The patient, if you listen to them, will tell you what's going on with their system. And you can pick a lot up just by looking at a person after you're aware of what to look for. You can say that well, based on your symptoms and the way you look, you've got a problem with your thyroid, or there's a big stress issue going on. Lots of those things that people discount.
And particularly with the labs, I guess there are certain ranges that are considered normal. But if you're within the normal range, but maybe on a high end or a low end of whatever indicator, it could herald a condition that might be in the offing.
Yeah, we do. Yeah, there's a lot of stuff that we've gotten a lot better at, specifically for insulin resistance and diabetes, which plays a really strong role for women in hormonal dysfunction as far as their cycles go, and for men in terms of obesity and their sex drive. When you start getting into insulin resistance, that's the precursor to diabetes. And so we can pick that up significantly earlier than where I was initially trained 10 years ago.
And then you can make lifestyle changes that may be able to
and that's
forestall that a little bit.
That's the majority of what we try to do with folks is like, look, this is the train that's headed your direction. If we want to make some corrective courses, great, we can do that. And we have the tools to do that, whether it's psychologically or if it's dietary-wise. Some of it just comes down to cutting sodas out of your diet, and eating a couple pieces of less bread when you're at dinner.
Maybe only like 1 or 2 slices of pizza instead of a whole pizza.
Yeah, exactly. And we have a lot of folks that do that, and then we have others that want to do better, but it's too hard. And so they, we'll manage those too. If it gets too hard, and then they just would rather do the medication side of things, we can do that too. Which is the standard Western medicine approach. But we try to find some middle ground for folks that if you want.
There's got to be a sweet spot.
Yeah,
see the doc
exactly.
once a year, get a checkup. If you're not feeling well in between, go see him.
Right.
And that's probably a good rule of thumb.
There
I
you
would
go.
think. Yeah.
Exactly.
And the new location, you'll be able to do that both in town here and out on the beach now.
Yes, sir.
It's just going to be awesome.
Yep.
Do you have people who go to the doctor too much? I mean, is there such a thing? I mean, as like the worried well?
Well, not that many. Most of what we have, as far as that would even come close to that category, are folks that are just really have a lot of issues going on.
Right.
They got coronary disease or diabetes or neuropathy issues, or they've had a stroke or cancers and those kinds of things. And for the most part, if you've had cancer, I'd be pretty worried too. And
you want
I'd
to
be
keep
going
an
to see
eye
the
on.
doc
If
a
you've
lot
got a
more often.
pre-existing condition, then I guess it's warranted.
Exactly.
Dr. Roman Nation, thank you so much for coming back on the show, and good luck with the new location
Yes, sir.
at Nation's Best Family Healthcare.
Yes, sir. Thanks.
And we'll be right back after your Mad Hatter Minute.
Hi, I'm David Lovett, and this is your Mad Hatter Minute. Today we're going to talk about fuel economy, gas mileage, how to get better gas mileage. And it's real simple, and a real simple thing that you can do at home. There's actually 2 main factors that go into your gas mileage. 1 is a clean air filter, and 2 is proper tire pressure. Your air filter is the first filter on your vehicle. Takes air, fuel, and fire to make your vehicle go. Air comes in through the intake. There's a filter to stop any type of dirt and debris and trash and bugs from getting inside your motor. That filter gets clogged, it gets dirty, and it can't breathe. And when the engine's struggling to breathe, it has to increase the gas ratio, which throws your your air to gas ratios off, and your vehicle doesn't want to run right, and you start losing gas pressure. Check your air filter every time you have your oil change. Have your oil changed every 3,000 miles, and just pop the hood and have your service technician check that air filter. If it's dirty, change it. The second thing that affects gas mileage most is your tire pressure. Look at your tire pressure. You can get a tire gauge, or you can stop at any service station, and they can test your tire pressure. Typically, tire pressure on a passenger vehicle runs roughly right around 35 pounds. If you really want to know the exact pressure, look at your tires. On the tire itself, it'll say 35, max 35 psi. That's the maximum amount of pressure you want to have in your tires. And if you also want to know, you can look on your car, on the pillar, on the inside of the front door. It'll also give the tire pressure. That's the pressure you need to be running at. Running too low makes the tire flat, and it creates drag. So it takes more to start your vehicle running. And the harder it is to run, the more gas that you're going to burn. This has been David Lovett, and this has been your Mad Hatter Minute.
Welcome back to the show. I'm here with Dr. Aaron Shores from Spine and Neuro Pain Specialists. And we're going to talk a little bit about drugs today and pain drugs, if you don't mind. I have a few questions for you.
Great.
Side effects. Now, I told you off camera of a problem that I had when I was on hydrocodone for a dental procedure. Is that very common?
Yeah, side effects are unfortunately nothing. I tell our patients that unfortunately very few things in healthcare are risk-free. So everything has side effects, including medications. So side effects are very common with taking different pain medicines, particularly the narcotics. Mm-hmm. So we always have to balance the good that the medicine provides with the side effect profile that sometimes can be a risk to the patient.
And like with my hydrocodone episode, I just felt like dopey the whole time. I just didn't feel mentally aware or awake. I wasn't mentally nimble at all. It really had a bad effect on me. I didn't like it at all.
Right.
And that's something you should expect, I guess, when you're on painkillers.
Certainly, sedation is a very common side effect with narcotics. As well as constipation, confusion, urinary retention. There's even hormonal changes that can be associated with chronic use of narcotic therapy. So we always want to balance the risk and benefit of using those medications and try to do the best we can to identify a patient's problem and see if we can treat it and then decrease or stop the amount of medication they're taking.
And I'm sure you see a lot of people who are in chronic pain.
And
hence the name of your practice, Spine and Neuro Pain. And I'm sure there's a fair degree of prescription drugs that you prescribe to people.
Correct.
But that's only for, I guess, a limited time. I mean, can you take hydrocodone for the rest of your life for chronic pain?
Well, you certainly can, but I think and there's different philosophies on this, but our particular philosophy in our practice is again to try to identify an individual's particular problem and see if we can treat it. And that treatment includes medication, maybe therapies, maybe other modalities to solve and treat the problem in hopes of stopping the medication would be ideal. But certainly keeping the medication consumption at a minimum, because patients certainly can stay on the medications for the rest of their life. But again, these medications, even in chronic use, when taken appropriately and as prescribed, still can have side effects associated with them. So we want to make sure that we have, if the patient does have to stay on the medication for the rest of their life, or certainly long term, it's the least amount of medication possible that provides the greatest amount of relief.
Do you build up a resistance? Say you're in chronic pain and you're taking pain meds. I mean, does the same amount of drug become less effective over time, or do you have to increase that for it to actually do that?
Yeah, great question. Yeah, and certainly, tolerance is what that term is called, is well described in the literature with opiates and chronic use, and that certainly can be a problem. But sometimes when patients develop a tolerance to medication, there are other reasons for that. So when someone comes back into us and says, the medication I'm taking is no longer working, I think we need to explore why that is. Is it truly just tolerance to the drug? Is something else going on?
What else could possibly do that for someone?
Well, sometimes patients develop other issues. Many times, particularly when related to the nerve, the medications are just not terribly effective. And I think sometimes that comes as a shock to people sometimes, where they're taking large doses of various pain medicines, and they say that it just takes the edge off or doesn't help.
Maybe they're taking the wrong med. They need to switch up to something
maybe they're
else.
taking the wrong medication, or sometimes we'll see patients who've tried a variety of different medications and they still don't work. And we have to sometimes say, the medications, unfortunately, for your particular problem just are not going to provide a substantial amount of relief. So maybe we need to explore looking at other issues.
And I would imagine also, and I know, pain medicine is probably very highly regulated because of the addictive qualities of some of the drugs that you have to prescribe to people who are in chronic pain.
Yeah.
And I guess that's a risk too.
Yeah.
For long-term pain
It
management.
is, but it's an inconvenience that the patients have to go through. I think most patients know that there's regulations that have to be imposed on them when they take the medications, because we have a responsibility as prescribers to make sure patients are taking them responsibly, using them, they're getting good effect with limited side effects. And that includes sometimes random drug screens and pill counts and those things, which sometimes I think patients find it
Kind of obnoxious.
obnoxious or insulting or certainly an inconvenience, and it's just part of the standard of care that's out there, because the old saying, there's a few bad apples spoil the bunch, and
is true.
Prescription drug diversion is a big problem here in the United States. But we find in our practice that the large majority of patients are using the medications for benefit and appropriately, and are looking to solve their issues so they don't have to take them.
Suffice it to say, proper drug use, can certainly help you, but it's not just drugs. There are a whole bunch of other therapies that you can do for people at spine and neural pain specialists here in Panama City. Dr.
Correct.
Aaron Shores, thank you so much for coming
Thank
back
you.
on the show and talking about this very important topic.
Thank you.
And we'll be right back. Welcome back to the show. I'm here with Thomas Winterman, the author of The Thrive Life. Thomas, you've been giving us these great Thrive tips for the week. How should we start our week out?
For this week, it's to know what you want.
Know what you want.
Yeah, one of the issues with goal setting is that people tend to set 10, 15 different goals and try to go after them all at once. They want to lose weight, they want to be able to compete in a 5K, they want to go back to college, have a better relationship with their spouse, be better at work. And the problem is that if you want to do these effectively, there's going to be some conflict there between the goals. If you're going to school, you can't spend more time with your kids. If you're trying to be better at work, you're not really going to have the time to devote to losing weight and getting healthy. So you really have to figure out what you want.
So you really have to rank order your goals and find a time for those.
That's right. Have you been reading the book?
I don't know.
That's
I've been
directly from the book.
Oh, is it really?
Yep.
See that? Yeah. Well, see, it's all common sense.
That's right.
Not so common with some people.
Yeah.
But I mean, especially for young people. A lot of young people don't even know what they want yet. And they're just going to school trying to expose themselves to a bunch of different topics or subjects to see what really interests them. So maybe the goal is like, get a liberal arts degree. Let's figure it out. Or maybe the goal is just, to have a goal by a set time.
Right. And there's this counseling theory called solution-focused counseling. And one of the tenets of that is that you can ask yourself one question to sort of gives yourself a little bit of focus on what you really want. It's called the miracle question. And it says, suppose that while you sleep tonight, a miracle occurred. When you woke up in the morning, what would you be believing, doing, or thinking about yourself that would tell you that a miracle happened? And it's a really deep question, and it takes a lot of thought and a lot of understanding about yourself. But if you ask yourself that and you answer it truly, you'll get an idea of what you really want and what's more on the periphery.
So this miracle that we would imagine, we don't even know what it is yet.
Nope.
But what would you be feeling if that miracle happened? And then if you're feeling good about yourself and maybe you're, it gives you a better idea of what it would take to get to that point, I guess.
That's exactly what it is.
And that's your goal.
Yep, and you can start to make a plan and map out a way to get a little bit closer to that miracle scenario.
So you'll have that feeling when you wake up in the morning. Hey, I feel really good about myself. I feel really healthy. I feel motivated. I have a lot of energy. I'm surrounded by loved ones. Now, what's the goal I need to set to get to those feelings?
That's right.
That's a pretty amazing way. That's almost like reverse engineering a goal.
Take it backwards.
Yeah. That's got. So again, the Thrive thought for the week is
Know what you want.
know what you want. Thomas Winterman, author of The Thrive Life, thank you again for bringing your wisdom to our little show. Know what you want, and we'll see you next time.